Hi, this is Colin Hung from Healthcare IT Today, and I'm joined by Kim Franks, Vice President and General Manager of Consumer Health at Allscripts. Kim, thank you for joining us on the program today.
Thank you. It's my pleasure.
All right, let's dive right in, Kim. I've got a question for you. You look after product development and product side at Allscripts, at least for one of the products that you have there. And this pandemic has really caused a lot of development teams and product teams to do things differently. Is that the case for you?
It is. So the product that I'm involved in is a patient-facing product, which is a patient portal and a personal health record. And it was apparent very quickly at the onset of the pandemic that we were going to have to do things differently. A lot of our clients wanted access to telemedicine and being able to see their patients remotely. And we had a very little time to react to get them the tools that they needed.
And what was the trigger? Was it just the flood of phone calls? Was it, a bunch of customers just emailing you? What was the trigger to say, oh boy, this is something totally different?
We heard from our clients in a lot of different ways. Some of it was through our support channel. Some of it was reaching out to me directly. Some of it was reaching out to the Allscripts CEO himself. And how could we help them maintain some sort of normalcy with their patients and getting their patients the care that they needed while trying to work through how operationally they react to this pandemic.
And was it just telehealth they were asking for, or were there a bunch of other things that they were kind of demanding of you?
So there were a lot of things that they were asking for. My wheelhouse is specifically on the telemedicine and patient monitoring side of the house, and so that's what I am most familiar with.
And was that product already in place, and and you just really had to kind of, or did you have to enhance a lot of it in order to get it ready for your customers?
So it was a little bit of both. We've had telemedicine and our product functionality for several years. I think that a lot of clients have struggled with how to operationalize something like that on a large scale, and so not very many of our clients had it installed. There's also the industry trend that for patient portals, you typically have between 20 and 30% of your total patient population enrolled in a portal, and so that's traditionally only reaching 20 to 30% of your patients that have needs that you need to see. And so we had to figure out how to quickly enable and deploy and implement a telemedicine solution, and then how to very quickly make it so that it was a solution that was valuable for all of their patients and not just their patients who happen to have a portal account.
And what did you, if anything, did you have to do differently internally? Did you shorten any processes, get rid of some things in order to speed all this up, or was it sort of business as usual internally for you?
It is definitely not business as usual. We have some pretty stringent processes involved in our release schedules, how we get things ready for release, the QA around them, and we really dropped everything. Our roadmap was non-existent from March through even today. And we have been reacting very heavily to the client's needs around telemedicine. And that includes doing things like many small releases where in typical fashion, we wouldn't release any new feature set in what we call a CU update, which is a pretty small update that we reserve to help resolve some pretty the issues around things that need to get out quickly in between releases. And so we've had to backtrack on that. We've done about 7 releases, what we call CUs, in the last 6 weeks in response to this. And that is really fast-tracking the development, fast-tracking the requirements gathering, fast-tracking the QA, and getting it into the hands of our clients so they can use it.
And how have your teams internally reacted to this, to being working on these sort of tighter timelines?
So it's interesting because it has reinvigorated some of our dev teams where they actually feel that in this pandemic, they are doing something that is very worthwhile in helping people, both our clients and our patients. So it's been interesting to watch. It's been fun to see, and they are giving it their all to get the tools that our clients need out to them.
Did you have to do anything special to motivate them? Any extra donuts or anything like that to get the? No, wow.
They get to work from home.
I guess that is a bonus these days. I think that's a positive way to look at it. We all get to work from home.
That's right.
Now, how have your clients reacted to this? Because normally I'm assuming that, rapid releases is probably not a thing that a client really looks forward to, but in this world, I guess it is something that they have asked for.
Yeah, they've been absolutely wonderful about it. We created a shortened implementation time frame. So typically from when a patient said that they wanted telemedicine to when we had it installed is about 7 days. We came with some pre-configured suggestions and best practices for them. And we really started to make those improvements that they were very rapidly, week over week, able to see that made their lives easier and better from an operational standpoint.
And is there anything that you've learned through this process that you're going to use to carry you forward when things start to calm down a little bit?
So I don't know that our roadmap will ever go back to what it was pre-pandemic, right? We're not going to just pick up our roadmap as it was and start working on it in a couple of months. I think it takes a lot of time to sit down with our clients and ask them, how has this changed you operationally? And has this changed you operationally for the foreseeable future, where we need to relook at our roadmap, the things that are on our roadmap, and focus more on these tools that give you the flexibility to see your patients in a variety of atmospheres.
And if someone else in your role at a different company, not a competitor, but another company, what advice would you give them in terms of how to get your teams motivated and rallied behind changing up their standard procedures and kind of shortening and compressing things and doing things differently than what they were used to?
I think that this has really presented us a unique opportunity for our teams to see that they really do have value and they impact the lives of a lot of people. And I have spent a ton of time talking to our coworkers and our employees about, I think it's really difficult for developers and some support people to understand the reach that we have. But it's not just our clients and the physicians and the nurses, it's the patients and it's their caregivers and it's the pharmacies who have to fill those medications. And so we have a very wide-reaching, while not maybe directly, but indirectly to a lot of different people in the healthcare system. And I think that that's really hard for some people to understand and grasp when you're not from the healthcare field. And this made it abundantly clear to our employees what kind of value they actually have and how they really can make a difference. And there, you can't find motivation like that in a lot of places. And I think that it was really important, and they saw it and they stepped up and they delivered, and they are continuing to deliver. And it is impressive.
And Kim, what's one thing that you've learned through this entire process working with your teams? What's the one thing you've taken away?
So I think that that healthcare can be as nimble as other industries. I think that we get beat down a lot, and that healthcare is behind the times in technology, and we're behind the times in adopting new policies and new procedures and new ways of doing things. And I think that this shows that we can make those adaptations, and we can make things a much better place for our patients and for our clients. And as a nurse, it is something that really makes me happy to see that our clients and the patients are really embracing the technology.
Awesome. Kim, final question. Where can people go to find more information about Allscripts?
You can find us at www.allscripts.com.
Awesome. Kim, thank you so much for sharing the information with us today. It's really insightful to see what you guys are doing behind the scenes to deliver for your customers. Thanks for being on our program.
Yeah, thank you. I appreciate it.
This is Colin Hung from Healthcare IT Today. Thanks for watching.